Hi, I'm Dr.Diviya, your gynecologist. Today we will be talking about puberty in girls. Puberty marks the entry of a child into a girl's world. However, it is a medically important event because puberty at the right age ensures two important medical facts. One, the relationship between the various hormones within the body is functioning in a normal fashion. Two, the relationship between the various reproductive organs like the uterus, ovary, tubes and the vagina is well established. There is no obvious obstruction or developmental problem in the reproductive tract. Thus, puberty in the right age is an indirect indicator of normal functioning of good general health as well as the reproductive health. Proceeding on, we will be talking about few important and commonly asked queries regarding puberty. The number one being, which is the common or the right age for puberty? I would like to mention that puberty is a process of changes. So it is a time frame between 10 to 14 years is when you can expect these changes. Anytime you notice puberty related changes before the age of 10 or you are not seeing any changes at all up to or beyond the age of 14, please meet your gynecologist and have an assessment. So what are the changes that you will be expecting? The commonest or the most noticeable physical change and which is the initial change will be the growth spurt. In other words, the mother or the family members will be able to appreciate a sudden increase in height in the girl child. Following this, there can be changes in the breast which can be noticed. You will be able to notice an elevation in the nipple areola region which is called as the breast bud. And there can be very small, slender hair growth in the pubic region as well. Following these changes, the final event would be the menstruation per se. Thus, if you happen to see any of these puberty related changes or if you happen to have a girl child between the age of 10 to 14 years, it is a good idea to have an one-to-one conversation with your daughter regarding the puberty changes and the bodily changes that can be expected during this time. You have to emphasize and make sure that the child understands that these changes are very much normal. We can have a chat with them regarding the usage of sanitary pads and it would be advisable for you to demonstrate the usage of a sanitary pad. Thus, in case they happen to menstruate in your absence, the child will be able to manage the situation and we can avoid unnecessary embarrassment for the child. And beyond this puberty, after attaining puberty, we do happen to see few common problems like increased menstrual flow, irregular cycles, increased pain during periods as well as anemia. So it is a good idea to have a gynecological consultation once your child reaches puberty. This will ensure that any problem can be picked up at the earliest and treated appropriately. So help your child have a wonderful and peaceful puberty journey. Thank you. Bye.